7 Vitamin B12 deficiency signs that can affect your brain. Have you ever stood in a room and forgotten why you walked in, or reached for a familiar name and watched it slip just out of grasp, only to have it surface an hour later out of nowhere? Most people wave this off as simply what getting older feels like. That belief is incomplete, and it may be keeping people from noticing something changing quietly inside their own mind. Something that has very little to do with age itself and a great deal to do with a single vitamin most people never think to test for. This video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If any of what you hear today sounds familiar, it may be helpful to speak with a healthcare professional who can evaluate your individual situation. Vitamin B12 does far more than support red blood cells. It plays a role in how nerve cells communicate, how the brain processes information, and how mood and memory are regulated day to day. When levels drop low enough and stay low long enough, some people begin to notice changes that feel less like fatigue and more like their own mind is behaving differently. A little slower to recall a name, a little foggier by mid-afternoon, a little more irritable over something small. These changes can be easy to dismiss, especially in older adults because they resemble ordinary aging or stress, when in fact they may be pointing to something else entirely, something that is often simple to check for and in many cases manageable once it is found. Today we are walking through 7 signs that researchers and clinicians have associated with low vitamin B12 levels and their impact on brain function. Some of these are well known. Others are subtle enough that most people never connect them to a vitamin at all. And there is one sign, appearing later in this video, that tends to surprise people the most, because it is so often mistaken for something far more serious, something families worry about quietly for months before ever thinking to ask about a simple blood test. Stay with us because understanding these signs may help you notice patterns in yourself or someone you love, perhaps sooner than you otherwise would have. Before we begin, it helps to understand why B12 matters so much for the brain in the first place. Vitamin B12 is involved in producing the protective coating around nerve fibers, called myelin, which allows electrical signals to travel quickly and accurately between brain cells. It also plays a part in making certain neurotransmitters, the chemical messengers that influence mood, focus, and mental clarity. When B12 is scarce, this system does not fail all at once. It tends to falter gradually, which is part of why the early signs are so easy to overlook. There is another layer to this story that rarely gets mentioned. Vitamin B12 cannot simply be absorbed by eating enough of it. The body relies on a specific protein produced in the stomach, called intrinsic factor, to carry B12 through the digestive tract and into the bloodstream. This means that even someone eating a diet rich in meat, eggs, and dairy, all common sources of B12, can still develop a deficiency if their digestive system struggles to absorb it properly. This is one reason why B12 deficiency becomes more common with age, since stomach acid production and intrinsic factor levels can decline over the years. It also explains why certain medications, including some long-term treatments for acid reflux and diabetes, have been associated with lower B12 absorption over time, and why individuals following strict plant-based diets without supplementation may be at higher risk as well, since B12 is naturally found almost exclusively in animal-derived foods. Understanding this absorption process matters because it shifts the conversation away from simply asking what someone eats and toward a broader question of how their body is functioning as a whole. A person can have what looks like a perfectly balanced diet and still develop a meaningful deficiency, which is exactly why relying on assumptions rather than blood work can allow this condition to go unnoticed for years. Number 1, memory lapses that feel different from ordinary forgetfulness. Everyone forgets things occasionally. Keys get misplaced. A name slips away mid-conversation only to resurface an hour later. This is normal and it happens to people of every age. What researchers have observed with low B12 levels is something a little different in texture. It is not just forgetting where you put something, it is a broader difficulty holding on to recently learned information, following a conversation with several points, or remembering why you walked into a room, happening more frequently than it used to. Margaret, a 71-year-old retired schoolteacher, described it to her daughter this way. She said her thoughts felt like they were written in pencil instead of pen, easily forgotten instead of firmly set. She had always prided herself on a sharp memory, and the change worried her enough that she brought it up with her physician. A blood test revealed that her B12 levels were significantly below the normal range. This single detail does not mean every memory concern points to a vitamin issue, since memory changes can have many possible causes, but it illustrates why unexplained memory shifts are worth mentioning to a doctor rather than assuming they are simply a normal part of getting older. What makes this particular sign tricky is that it can be gradual enough that the person experiencing it may not notice the full extent of the change. Family members or close friends often notice first, since they see the pattern across weeks or months rather than living inside it day to day. If someone you love has started repeating questions they already asked, or seems to lose the thread of a story more than they used to, it may be worth having a gentle conversation about getting some basic lab work done. There is also a distinction worth understanding between what researchers sometimes call working memory and long-term memory. Working memory is what allows a person to hold a phone number in their head just long enough to dial it, or to follow a multi-step instruction without losing track partway through. Some of the earliest changes associated with low B12 levels tend to show up in this working memory space first, before affecting long-term recall of names, dates, or past events. This is part of why a person might still vividly remember details from decades ago, while struggling to remember what they had for breakfast that same morning. Recognizing this pattern can help distinguish ordinary forgetfulness from something that may deserve closer attention, though only a healthcare professional can make that determination with proper testing. Number 2, a persistent mental fog that does not lift with rest. Brain fog is one of those phrases people use loosely, but when it comes to B12 deficiency, it has a fairly specific feel. It is often described as a kind of mental heaviness. Thoughts take longer to form. Simple decisions, like choosing what to order at a restaurant, suddenly require more effort than they should. Concentration on a task, whether it is reading an article or following a recipe, becomes harder to sustain for more than a few minutes at a time. What separates this from ordinary tiredness is that a full night of sleep does not seem to fix it. Someone might wake up feeling physically rested, yet still find that their thinking feels slow and clouded through the morning and into the afternoon. This distinction matters because it may help a person recognize that what they are experiencing is not simply a matter of needing more rest. David, a 48-year-old accountant, noticed this during tax season, a time when his job demanded sharp focus for long stretches. He assumed the fog was simply job stress catching up with him. After weeks of feeling like he was working through mental static, he mentioned it to his doctor almost as an afterthought during an unrelated visit. Routine blood work showed his B12 levels were low, something that can happen even in relatively younger adults, particularly those following certain dietary patterns or dealing with absorption issues in the digestive tract. His experience is a reminder that brain fog is not always explained away by a busy schedule, and it may be worth ruling out nutritional causes when the fog persists despite adequate rest. What often gets overlooked with this particular sign is how it can quietly affect a person's confidence in their own abilities. Someone who has always been a fast and clear thinker may begin to second-guess themselves in meetings, take longer to respond to simple emails, or feel unusually drained after tasks that once felt effortless. Because the change tends to develop gradually, many people adapt around it without realizing how significant the shift has become, sometimes attributing it to burnout, aging, or simply having too much on their plate. This is precisely why brain fog deserves a second look when it persists for weeks rather than days, especially when rest and reduced stress do not seem to make a meaningful difference. Number 3, mood changes that feel uncharacteristic. Vitamin B12 is involved in the production of serotonin and dopamine, two neurotransmitters closely tied to mood regulation. When B12 runs low, some individuals report mood shifts that feel foreign to their usual temperament. This might show up as increased irritability over small frustrations, a flatter emotional tone than usual, or a sense of low mood that does not seem tied to any particular life event. It is important to be careful here, because mood changes have many possible causes, and this sign should never be used to self-diagnose depression or any other mental health condition. However, healthcare providers do sometimes check B12 levels as part of a broader evaluation when someone reports new or worsening mood symptoms, particularly if other physical signs are present alongside them. Consider Robert, a 63-year-old widower who lived alone. His son noticed that his father, once known for his dry sense of humor and easy laughter, had become quieter and more withdrawn over several months. Robert himself described feeling flat, as though the color had been turned down on everything. His doctor considered several possibilities, and blood testing revealed a marked B12 deficiency alongside other findings. Addressing the deficiency was one part of a broader conversation about his overall health and well-being, discussed together with his medical team. This story illustrates why mood changes deserve a thorough evaluation rather than a single explanation, and why ruling out physical contributors can be a meaningful part of that process. It is worth noting that mood-related changes tied to B12 levels do not always look like sadness. Sometimes they present as a shorter temper than usual, a reduced tolerance for noise or minor inconveniences, or a general sense of restlessness that a person cannot quite explain. Loved ones sometimes describe this as the person seeming like themselves on the surface, but somehow harder to reach underneath, a subtle shift in warmth or patience that feels out of character over time. Because grief, life transitions, and other health conditions can produce very similar patterns, this sign is rarely enough on its own to draw any conclusion. It becomes far more meaningful when considered alongside physical symptoms or a doctor's broader clinical assessment. Number 4, tingling numbness or a pins and needles sensation. This sign moves slightly outside the brain itself and into the wider nervous system, though the two are deeply connected. Because B12 supports the myelin sheath protecting nerve fibers throughout the body, a prolonged deficiency can lead to nerve signals misfiring, particularly in the hands and feet. People describe this as tingling, numbness, or an unusual buzzing sensation, sometimes compared to the feeling of a limb falling asleep, except it does not go away after a few minutes of movement. What makes this sign meaningful in the context of brain health is that when peripheral nerves are affected, it often signals that the deficiency has been present long enough to also be influencing the central nervous system, including the brain. In other words, this sign can act as an early warning that prompts a more complete evaluation of neurological symptoms overall. Eleanor, a 78-year-old retired nurse, noticed a persistent tingling in her fingertips that made it difficult to fasten buttons or hold a pen steadily. Given her medical background, she recognized this as worth investigating rather than dismissing. Testing confirmed a significant B12 deficiency, and her physician explained that nerve-related symptoms like hers are a well-recognized feature of the condition, one that may be associated with more advanced or prolonged deficiency if left unaddressed. Her case is a useful example of why physical sensations in the hands and feet should never be brushed aside as simply a sign of getting older. This particular sign tends to follow a noticeable pattern in many cases, often beginning in the toes or fingertips before gradually spreading further along the limb if the underlying cause is not addressed. Some people describe it as their hands or feet feeling slightly disconnected from the rest of their body, as though wearing an invisible glove or sock that dulls sensation just enough to be noticeable. This can make everyday tasks requiring fine motor control, such as buttoning a shirt, typing on a keyboard, or picking up small objects, feel unexpectedly clumsy. Because these sensations can also be associated with other conditions entirely, proper evaluation is essential, but the pattern itself is distinctive enough that it should never be quietly tolerated for months without mentioning it to a doctor. Number 5, balance problems and unsteady walking. Similar to the tingling sensation just described, difficulty with balance and coordination can emerge when B12 deficiency begins to affect the nerve pathways responsible for spatial awareness, sometimes referred to as proprioception, which is the body's sense of where its limbs are positioned in space without needing to look. When this system is disrupted, walking can feel less stable, and some people describe a subtle unsteadiness, almost as though the ground is slightly uneven even when it is perfectly flat. This sign is particularly important to take seriously in older adults, since balance issues are closely tied to fall risk. A fall that might seem minor can lead to significant injury, especially in someone already dealing with reduced bone density or other age-related vulnerabilities. Recognizing balance changes early and discussing them with a healthcare provider may help identify contributing factors before a fall occurs rather than after. Harold, an 82-year-old retired mechanic, mentioned to his daughter that he felt like he needed to hold the railing more carefully on stairs he had walked for decades without a second thought. He had not fallen, but the change in confidence was noticeable to him. His physician ordered blood work as part of a broader neurological assessment, and low B12 was identified as one of several contributing factors to his symptoms. This case illustrates how balance changes, even subtle ones, deserve attention rather than automatic acceptance as an unavoidable part of aging. Balance-related symptoms can also show up in less obvious ways than an outright stumble. Some people notice they feel more hesitant walking in the dark, since reduced visual cues make the body rely more heavily on that internal sense of positioning we mentioned earlier. Others describe a vague unsteadiness when turning quickly or standing up after sitting for a while. Because these symptoms often develop slowly, many people unconsciously adapt their movements to compensate, walking a little more carefully or avoiding certain activities without fully registering why. Bringing these small adjustments to a doctor's attention, rather than assuming they are simply part of getting older, can open the door to identifying a treatable underlying cause. Number 6, confusion or disorientation that comes and goes. This is the sign we mentioned earlier in the video, the one that surprises people most often, because it is so frequently mistaken for something else, particularly in older adults. Episodes of confusion or disorientation, where a person seems briefly unsure of the day, the time, or even familiar surroundings, are sometimes assumed to be an early indication of a serious cognitive condition. While that possibility should always be evaluated properly by a professional, it is worth knowing that B12 deficiency can produce very similar symptoms, and in some cases, addressing the deficiency has been associated with improvement. This does not mean every episode of confusion is caused by a vitamin deficiency, and it should never be assumed to be the explanation without proper medical evaluation. But it does mean that ruling out B12 levels is often one of the first and simplest steps a doctor will take when confusion is reported, precisely because it is treatable and because catching it early may make a meaningful difference. Consider the story of Dorothy, an 85-year-old grandmother who, during a family dinner, seemed to briefly lose track of the conversation and asked what year it was, something entirely out of character for her. Her family understandably grew concerned about the possibility of a more serious condition. Her doctor took the concern seriously and ordered a full panel of blood work, which revealed a severe B12 deficiency. Once appropriately treated under her doctor's supervision, her family noticed a meaningful improvement in her clarity over the following weeks. Her story does not mean this outcome applies to everyone experiencing confusion, since many causes of disorientation exist and each requires individual evaluation, but it does highlight why a simple blood test is often one of the earliest and most valuable steps in understanding new confusion, rather than assuming the worst without checking first. What makes this sign especially worth discussing is how differently it can present from one person to the next. For some, it appears as brief moments of disorientation that resolve within minutes and are easily forgotten by the person experiencing them, even as family members remain concerned long afterward. For others, it can look more like difficulty following a conversation with several people speaking at once, or trouble keeping track of an unfamiliar schedule, such as a new medication routine or a change in daily activities. Because confusion can stem from so many different causes, ranging from medication interactions to sleep disturbances to more serious neurological conditions, this sign should never be used as a basis for self-diagnosis in either direction. It should instead serve as a prompt to seek a proper evaluation, where B12 testing is often included precisely because it is inexpensive, straightforward, and addresses a cause that can potentially be identified early. Number 7, vision changes that are easy to overlook. The 7th sign is one of the least discussed, yet it connects directly back to the same nerve pathways we have been talking about throughout this video. The optic nerve, which carries visual information from the eye to the brain, relies on the same myelin protection that other nerves in the body depend on. In some cases of prolonged B12 deficiency, this nerve can become affected, leading to blurred vision, sensitivity to light, or subtle changes in color perception that develop gradually enough to go unnoticed at first. This sign is often the last one people think to connect to a vitamin deficiency, since vision changes are more commonly associated with aging eyes or conditions specific to the eye itself. However, when vision changes appear alongside some of the other signs discussed today, particularly memory changes, tingling sensations, or balance issues, it may be worth mentioning the full pattern to a healthcare provider rather than describing each symptom separately during a rushed appointment. Frank, a 66-year-old retired postal worker, had already been dealing with mild tingling in his feet for several months when he noticed his vision seemed slightly dimmer than usual, especially in low light. Individually, neither symptom seemed urgent enough to prompt an appointment. Together, they finally did. His comprehensive evaluation revealed a significant B12 deficiency affecting multiple systems at once, underscoring why looking at the whole picture, rather than isolated symptoms, often leads to a clearer understanding of what is happening in the body. Vision changes tied to nerve-related causes can be especially easy to dismiss because they tend to develop so gradually that a person's brain quietly adjusts its expectations along the way, much like slowly turning down a light dimmer without anyone announcing the change. Colors may seem a touch less vivid than they used to, reading small print may require more effort or better lighting than before, and busy or high-contrast visual scenes may feel more overwhelming to process. Because normal aging can also affect vision in its own right, distinguishing between ordinary changes and something tied to nerve health requires proper examination, ideally involving both an eye care professional and a primary care physician working together. Bringing all of these signs together, what becomes clear is that vitamin B12 deficiency rarely announces itself with a single, obvious symptom. Instead, it tends to build quietly across memory, mood, sensation, balance, mental clarity, and even vision, often over months or years, which is exactly why it can be so easy to miss or misattribute to other causes. One statistic worth remembering is that some research estimates B12 deficiency may affect a meaningful percentage of adults over the age of 60, a group in which absorption naturally tends to decline with age, making awareness particularly important for older adults and the people who care for them. Identifying a B12 deficiency early tends to matter a great deal, since some of the neurological changes associated with prolonged deficiency may become harder to fully reverse the longer they go unaddressed. This is not meant to cause alarm, but to underline why these 7 signs are worth taking seriously rather than quietly living with for months or years. A simple blood test can offer real clarity where uncertainty might otherwise take hold. None of this means that every memory lapse, mood dip, tingling sensation, balance concern, moment of confusion, or vision change is caused by low B12. Many of these signs overlap with other conditions entirely, and only a qualified healthcare professional, using proper testing, can determine what is actually happening in any individual case. What this video is meant to offer is awareness, a reason to pay closer attention to patterns in yourself or in someone you love, and the confidence to bring these observations to a doctor rather than dismissing them as an unavoidable part of getting older. If any of these 7 signs sounded familiar, either in your own life or in someone close to you, we would genuinely like to hear about it. What sign surprised you the most, and has it changed how you think about symptoms you may have brushed aside before? Share your thoughts in the comments below, since these conversations often help other viewers recognize something in their own lives too. If you found this video helpful, consider sharing it with someone who might benefit from this information, whether that is an aging parent, a close friend, or simply someone who enjoys learning more about how the body and brain work together. And if you would like to see more videos like this one, subscribing helps us keep bringing this kind of educational content to you. Thank you for watching, and we will see you in the next one.